plays a large role. As most of us may know that when you're sleep deprived, even for a short period, it affects your mood. And in the postpartum period, sleep deprivation is something that is ongoing usually. Some of the things that would put mothers at risk for postpartum depression. So we would be looking at a personal or a family history of depression. So if a mother has had depression before or a family member with it, a personal or family history of bipolar disorder, or what we call premenstrual dysphoric disorder, which is a more severe form of PMS or premenstrual syndrome. Other risk factors for postpartum depression would be not having a lot of social support, certainly, having conflicts in your relationships, being ambivalent about the pregnancy. So you tend to find it more in unwanted pregnancies, having a history of depression in the actual pregnancy. So if you had depression from during the pregnancy, there's a 50% chance that it's going to go on to continue into the postpartum period. Other things that put moms at risk for postpartum depression would be a history of assault or trauma, being in an abusive situation, living in an unstable home environment. Moms who would have been on medication before but stopped it during the pregnancy are at high risk for relapse afterwards. And going through other social difficulties such as having financial problems would put them at risk. Some other things to consider as well is moms who have had medical illnesses, so who have medical illnesses unrelated to pregnancy or who have complicated pregnancies are at greater risk for postpartum depression. Mothers who have multiples, so twins and triplets and so on, are more likely to experience postpartum depression. And then other factors such as having trouble with breastfeeding and issues after delivery will be at risk for postpartum depression. In terms of the specific symptoms of postpartum depression, so I would have touched on just a general picture of what it looks like, but the very specific symptoms are what we call depressed mood. So moms will be sad most days for most of the day. They will lose interest in things that they once loved and find that they're no longer wanting to do those things. As I said, fatigue, but that's very hard to determine in a new mother. Poor concentration, having trouble remembering, having insomnia, so having trouble sleeping when they should be, or hypersomnia, so sleeping just excessively, are some of the symptoms. And then having changes in appetite, so either eating not enough or overeating. As I had said before, having that inappropriate guilt that other persons having trouble remembering. Well, you don't have to feel guilty about that. Feelings of hopelessness or even worthlessness. They might find themselves having poor self-esteem, and some of the more concerning symptoms would be having thoughts of death or thoughts of suicide, and perhaps thoughts of harming the baby. So that, of course, doesn't happen in every person with postpartum depression, certainly, but they can occur. And then some of the other less specific signs of postpartum depression would be things like feeling anxious, being very moody, crying a lot. We will see where there is difficulty bonding with the baby. So mom just does not have those feelings towards the baby, doesn't want to be around the baby. Withdrawing from other friends and family. They may be intensely irritable or angry. So not just sad, but lashing out, having angry outbursts. And then having perhaps negative thinking, so fears of not being a good mother. It is important that we are able to identify, these factors what postpartum depression looks like, because if it is untreated, there are certain effects that postpartum depression can have. So one of those is certainly going on to have chronic depression. So untreated postpartum depression can go on to long-term chronic depression. It will, as I said, lead to poor bonding with the baby. So that will be of concern. We are, of course, concerned about mom harming herself if she does have feelings like that. She may then not be functioning well in many areas of her life. So that may put a strain on her relationship, whether with her partner or the other persons in her life. It may lead her to have poor nutrition, not caring for herself appropriately. She may move to substance use for coping. So we may find alcohol use or smoking and so on to cope inappropriately. Strain on the persons in her life, just from perhaps just trying to help or not being able to help. If she has other children, we may also find some emotional or behavioral issues coming up with her other children, because she may be finding it difficult to cope with caring for a new baby, and therefore having trouble coping with caring for her other children. So, having identified that postpartum depression is something that can happen, and what it does look like, we want to know, when is it appropriate for, or when is it time for someone to seek help if we're thinking that postpartum depression is present. So as we said, we definitely want to be concerned if we're going into weeks. So 2 weeks, yes, maybe on the shorter end, but going into 4 weeks after the baby is born and mom is still kind of feeling those low feelings, we then feel concerned that, okay, postpartum blues has passed and now it's going on for a long time. Symptoms that are just getting worse as opposed to getting better. If we find that mom is having trouble caring for herself appropriately, not wanting to do the basic things for herself, or having trouble caring for the baby, if she's not able to do her everyday tasks, and certainly if she's having thoughts of harming herself or the baby, we would of course expect help to be sought. In terms of where a mom with postpartum depression can seek help. So typically we'll find that your obstetrician may be the first point of contact, because most moms are in close contact with them. And usually at about 6 weeks, most new mothers are going to visit their obstetrician for just a well visit. And so it's very often at that visit that these signs are picked up. So the obstetrician is usually might be the first line of contact. A general doctor can also be the first line. So we know that sometimes persons may be reluctant to go straight to a psychiatrist or a psychologist. And so very often it may be the general doctor or the obstetrician who is the first point of contact. And they can, well, the obstetrician not so much, but general doctors do treat uncomplicated depression. But certainly when we are talking about the postpartum period and breastfeeding, you perhaps want a psychiatrist on board as it relates to that management. With that said, new mothers can go straight to a psychiatrist or straight to a psychologist if there are concerns. In terms of how we go about treating postpartum depression, so for mild cases, what we call psychotherapy or talk therapy is quite appropriate. So that's usually done with a psychologist. Psychiatrists do that as well. Counseling is a simpler term for it, but it is essentially helping mom cope with stressors using different strategies at home to relieve some of the symptoms that she's having, and that doesn't include medication if you're just doing the talk therapy. But if we're talking about moderate to severe cases, so these are moms who are having trouble functioning on a daily basis, who are having many symptoms, who certainly are having feelings or thoughts of suicide, symptoms along those lines, medication is usually recommended, and we typically utilize antidepressants for the management of those cases. Most of the antidepressants, just a note that most of the antidepressants can be utilized in pregnancy and breastfeeding once it is along those lines. Once the benefit to mom outweighs medication is usually done under the guidance of a psychiatrist, and of course they will utilize varying for the things that will determine if we will use medication. Of course, mom's choice. Most of the antidepressants, just a note that most of the antidepressants at the top of that list can be utilized in pregnancy. Decisions will be made about breastfeeding once it is along those lines, just so that we know that medication are certainly done under the guidance of a psychiatrist, and of course possible to utilize them in the postpartum period that will determine if in some medication. Of course, mom's choice. Most of the antidepressants, just analyzing that most of the antidepressants at the top of that list can be utilized in pregnancy. Decisions will be made about breastfeeding. So as we just so that we know that I want medication certain highlights in general information or general tips that we would try and utilize new mothers in terms of prevention, determine in some medication. I don't want to use the term prevention to be lively, as in to say most of the certain things that we can just stop postpartum together, because of course there is a hormonal and chemical and things I wanted to really kind of highlight as general information and postpartum depression and utilize new models in terms of prevention. But where possible, there are some considerations to like their mental health as the goal and just not period. So certainly encourage all to have support parties are really kind of highlight as general. So especially if you're a first time mother, certainly utilize new models in terms of prevention. Encourage moms, but where possible, there are some where it is that they need to stay, make sure that as the whole intersection possible period. So certainly encourage all to have support parties are really kind of highlight as general. So especially if you're a parent and family, you will certainly utilize new models in terms of prevention, things like that, where possible, can be such that where it is that they need to stay, make sure that those actual intersection period. Some other recommendations are encouraging moms to spend quality time, take quality time for themselves. So especially if you're a parent and too often, we will certainly recommend that those mothers encourage things like that, sort of quiet and just such that where it is as it is not taking, make sure that those actually we can do one pair or up to 75% are encouraging moms to spend quality time, take quality time for themselves. So especially if you're themselves too often, and to certainly recommend that those mothers, encourage things like that, sort of quiet and just such that where it is as it is not taking, make sure that those actually encourage one pair or up to 75% are encouraging moms to spend quality time, take quality time to have a good network, especially if you're themselves too often, and to certainly share that with friends and family, encourage things like that, sort of quiet and just such that where it is as it is their partner, make sure that the partner may want to have a good of the separation but encouraging moms to spend quality time to have a good network, especially if you're themselves too often, yes, be share that with friends and family, encourage take a lot of time, sort of quiet and just share the experience where possible. The partner may want to have a to be able to laugh and talk and have people, even their friends from time to time, just to have a good network that are enjoyable, so that she doesn't share that period of isolation. Take a lot of time, sort of encourage her to share the experience where possible. The partner may want to have a culture, be able to laugh and talk and have even their friends. There's a weakness to have a good share that are enjoyable, so that she doesn't share that period of isolation. Take a lot of time, her family, encourage her to share the experience where possible. The partner may want to have a culture, be able to laugh and talk and have even their friends. There's a weakness to get as much sleep as to have a share that are enjoyable, and to get enough hours together. Some mothers meant to hear that isolation. With friends or family, encourage her to share. So we try and make a plan just for the partner and just culture to get a laugh hours there and so that there's not there's a weakness to get as much sleep as well. Share that urging them to decide and not some mothers meant to trap down to decide without getting something like that so we try and make a plan just for the partner finally just culture to get a laugh hours there that we want so that there's not there's light exercise so that we get as much sleep as well. Getting them to decide and then some mothers meant to trap down to decide without getting something like encouraging them to just so we try and make a plan just for the partner finally culture to get some of those other folks that we want so that there's not light exercise so that we get as much sleep as well and realistically getting them to decide and then some mothers meant to trap down to decide without getting something like encouraging them to just and just having a realistic expectation setting our goals that we want so that there's not all of us looking to be able to motivate and realistically getting them and further to that is that encouraging just have a support system that encouraging them to just these are just having a realistic expectation for them setting our goals that we want so that there's not all of us looking to be able to motivate and realistically getting them and further to that and for your attention, some of the their
Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much, and I see Vanessa Bantam raise hand. You may go ahead with your question. Okay, thank you so much,
And thank you for that. That is a very good point. That in our setting is generally the government needs, and we do have our domiciliary program, and so we do get home visits, and the midwives do play a large role in identifying those early. I myself work in the government system, so I should not forget them. Thank you for that. I work in the mental health clinic, so very often we get referrals from generally the government, from the midwives who have identified something. So though the presentation is quite general, and yes, specific to our situation, we play a large role in identifying those early. I myself work in the government system, so I should not forget them. Thank you for that. I work in the mental health clinic, so very often we get referrals from generally the government, from the midwives who have identified something. So though the presentation is quite general, and yes, specific to our situation, we play a large role in identifying those early. I myself work in the government system, so I should not forget them. Thank you for that. I work in the mental health clinic, so very often we get referrals from generally the government, from the midwives who have identified something. So though the presentation is quite general, and yes, specific to our situation, we play a large role in identifying those early. I myself work in the government system, so I should not forget them. Thank you for that. I work in the mental health clinic, so very often we get referrals from generally the government, from the midwives who have identified something. So though the presentation is quite general, and yes, specific to our situation, we play a large role in identifying those early. I myself work in the government system, so I should not forget them. Thank you for that. I work in the mental health clinic, so very often we get referrals from generally the government, from the midwives who have identified something. So though the presentation is quite general,
okay, thank you so much, JP Banton. And let me just say to all of us on the platform, and especially our fellow JPs, if I do not thank you this evening, it is because we have other persons on the platform who we have invited, right, who are not JPs, so I will just refer to Banton. And let me just say right. So we have a question here from Select Larissa says, how about if I do not tag you this evening? It is because we have other persons on the platform.
Well, that's a very challenging question. Everyone, so we're now going into a realm of grief.
let me just
having a loss
right.
solely
All
from
right,
depression
so we have a
is
question here from
devastating.
Suzette
I mean,
Lewis.
any loss is
How about if I
devastating, but
donate
certainly
a
if that
guide,
goes to
say
deliver.
8 months, how
And so
many
it's
other
difficult to
persons
say
on the
specifically
planet
how would
would
a mother cope
have
because we're really dealing with that
parents
grief
who are not
question, and we do know that
parents
grief is
to
different
remember
for
that.
everyone.
Let me just
So the answer to that, having a loss
right.
solely
All
from
right,
depression
so we have a
is
question here from
devastating.
Suzette
I mean,
Lewis.
any loss is
How about if I
devastating, but
donate a
certainly anyone who would
guide,
have lost
say 8 months, how
and so it's
many
difficult
other
to
persons
say
on the planet
specifically
would
loss a
have
co-parent
parents
children dealing with that
to
that
are
grief
not
is that we do know that there is significant loss in your life for everyone,
Let me
and
just
so
say
the answer to that, having a loss solely. So in
so we
terms
have a question
of
here from
coping, we're
Suzette
looking at
Lewis.
regular
How about
grieving
if I
skills
donate
that
a
anyone who
guide,
would have lost,
say
she has
8
to go
months,
through
how
all the
many
steps
other
and
persons on the
specifically
planet
loss
would
a
have
co-parent, she will have to go through feeling all of the emotions. She will perhaps require some amount of grief counseling specifically, you know, trying not to suppress what she's feeling, but go through all of the feelings. So it would be very individual because everyone grieves differently. But what we will be looking at is a grief counseling matter in that respect. Um, and because of the 8 months, which I suspect maybe you're asking about, because of the 8 months, then yes, she would have had all of the pregnancy hormones and also be at risk for having this postpartum depression type picture after the fact as well, right? So we'll be looking at grief on top of all of the hormonal changes. And so if beyond the regular grieving process, we are seeing where after same procedure, after weeks or months, we don't think that her grieving is, there's no such thing as normal grief, but we do know that grieving can become complicated and it can be extended, and the person can then look like they are now becoming depressed. And then we would have to take the procedure of treating her as depression. So to answer the question, we're looking at grief with potential depression on top of it. And so we want to do our line of grief counseling and intervene for depression if that is present.
Okay, so we see Suzette Lewis, you have your hand up, so we'll continue with you. You may go ahead with your question.
Good night, everyone. So I actually asked the question because I've been in that position 16 years ago,
Yes.
and I was not aware of these things. And so when it happened,
Mm-hmm.
I was like, it was new to me. I was the one who asked the doctors to see a psychiatrist, a psychologist, whatever, because I was feeling out of it.
Mm-hmm.
When it happened, I still had the baby inside of me.
Mm-hmm.
I was just feeling scared. You know, it was just, I
When
couldn't
in
explain what
life
was happening to me. It
it
was
is
just
you
terrible.
are tossed and torn.
And so I tried, and thank God I'm a Christian,
Mm-hmm.
to hold on to faith and to hold on to my prayer and everything like that. And my husband was there with me all the way. But it was very strange feelings.
Yes.
Never, I don't think I've ever experienced those feelings in my entire life.
Yes.
And yes, it may be from trauma in terms of coming from a home where there was abuse. My father and mother used to fight and all of them stuff. Um, but after leaving the hospital, I actually thought it was over, but that
Mm-hmm.
was when everything
Mm-hmm.
started.
Yeah,
And
no.
so I think my husband too was going through some things because he was like very quiet. And for me, I was crying and all them weird
Mm-hmm.
stuff at night. I couldn't sleep and all of those things. And for me, though, my main reason for coming on tonight is the fact that at the hospital, I would appreciate it if they could tell me what I was going through.
Right.
Nobody said anything to me. And I
Right.
understand that a lot of persons are still going through stuff or they have had experience where nobody, no nurse, nobody said anything. I
Mm-hmm.
remember when I had the baby, when the baby came out of me that night, the doctor came. He didn't say anything to me. He just do what he was doing. He didn't ask me if I was okay.
Mm-hmm.
I saw the baby. The baby was big. Baby looked okay. You understand? And
Mm-hmm.
the nurse, they didn't say anything to me. I remember I got confused at one point. I think my underclothes got twisted up in the what that thing that drip thingy. And I for a while I had to be there and just praying to God to help me to come out of the confusion to see what I was doing, and He did. But I'm just saying that I think I may have heard a nurse spoke before, sometimes since you have spoken. I'm just saying that at the hospital level and at the clinic, maybe I don't know if it's happening now, but I think at that time more needed to be done where that is concerned. So at least, or maybe I needed to read up and know the things that could happen to a mother. But I'm just saying that being that it was happening to me at the time, somebody could have explained what was happening to me. I'm the one who asked for something just to relax my mind or, so forth. Yes, so yeah.
Well, firstly, let me say, thank you for sharing that. That is an extremely difficult situation to be in. And so thank you
Yes.
for sharing your experience. And I'm sorry that was the experience that you had. Because I totally agree with you that when we look at, the patient who would have been yourself as well as your baby and your entire family truly,
Yeah.
is not just your physical well-being, but you
Mm-hmm.
should have been, referred. And I think what you're highlighting is a lack that we have in
Yeah.
terms of awareness of mental health and the importance
Mm-hmm.
of it, because even in the most simple, straightforward pregnancy, there
Mm-hmm.
are mental health challenges. So we can only imagine when there are complications and when there is loss,
Right.
the importance of mental health support. As I said, I do work in a mental health clinic, and I know that the midwives do their very best when they see things to refer them on to us. But and where I do work, we do have a women's center. So I know that
Okay.
very often in situations like that, they will be referred. I'm working in St. Catherine.
Okay.
So we do have, I know very often the obstetrics, they will refer because there's a counselor there. I know every hospital, and depending on the type of hospital, don't have access to a psychologist, don't have access
And
to a
can
counselor.
I say what happened the night after the baby, right? They put me in the room with everybody else with their babies.
Oh boy.
And that was like crazy because I remember one of the girls, she said to me, like, where's your baby? And I told her, and she was like, I would be mad right now. You
Yeah.
understand?
Yes.
So I don't think after such situation, you should be
Yes.
placed in a room with mothers looking at their babies, smiling
Yes.
and all of these things.
Yes,
Yes.
absolutely. I have to say that I'm sorry that that experience occurred, and I hope that whoever was involved in that situation would have gotten to hear the
Mhm.
concerns that you had, because that sounds like something that they need to make changes to
Yeah.
significantly.
Thank you.
Okay, thank you so much, Suzette Lewis, for sharing. And before I go to Vanessa Banton's hand, there's a comment, Stephanie Bernard Stevens said social support in that case is crucial because she will need persons who understand and allow the grief process
Right.
take place. There is another one that says, there's another comment I want to bring her. There's another. Where are we now? Okay. Why is it going away? Okay. Much emphasis is placed on the depression women go through as a result of pregnancy. Is there any mechanism to help men who may face some sort of depression because they have to deal with the reality of having to take care of a newborn for which he may not have been prepared? And I would like to, by extension, also say, because the question arises also, in this case, the man also, the father would have suffered a loss too,
Right.
and what is in place? Is there anything in place to also, attend onto the needs at that time of the fathers?
So this now, so we already are a little bit behind in the learning curve as it relates to mental health in general. You know that culturally in Jamaica, mental health is something that people find difficult to discuss. I think we are getting a little bit better with time. But with almost every mental health condition, the presentation is going to be women, majority women. In cases of anxiety and depression, you're typically going to find women presenting, and that is it across the board for all medical illnesses, because women have better health seeking behavior. But then added to that is the cultural issue of men sharing their emotions in our society and how we treat mental health generally and how we treat the mental health of men. But the fact of the matter is that men are no less affected than women. So a man is going to grieve just as much. A man is going to can experience depression or can experience anxiety. So it's not, that men are somehow immune to these things. It's just that society doesn't allow them to express it in the same way. So in terms of the specific channels that we have, we don't have any special channel in place. What we have is the same outlet. So in the same way that we have public care where you have mental health clinics, should you be feeling like you need someone to speak to. So it would be the same access, but I guess the difficulty would be that we need to ask more questions of the fathers. So it needs to be that when dad comes in for whichever visit with mom. So that's the other thing, where is dad present in the spaces where he may get help? Is it that dad comes to clinic too? But it really does mean that healthcare providers need to be asking more questions of dads, and that we need to not shy away from or pretend as if they don't have the same experiences. The outlets are pretty much the same, but we also need to do more mental health promotion towards men, which has been a push, in terms of men being aware of their needs as well and knowing that it is okay not to be okay. It is okay to seek help, but we are still going to have that challenge. So there's no special channel to get men, more identified, other than talking about it more and other than a more, I guess, sensitive or aware healthcare provider who can look at that and say, but how are you doing? And maybe just in prompting those kind of questions to say, but it sounds like you may need to go and talk with somebody as well. But I must say that other than the counseling center that we have for the women, it's not that we have something special for the partners as far as I am aware. But of course, our counselor would be willing to reach out and assist a dad if he was in that difficulty as well. We just need to talk about it more, ask more questions, and give them sort of the platform or the room to express that.
Certainly. Thank you so much. And by extension, overall, the bedside manners, if you will, or the bedside care, because this is a little aside, I recently interviewed someone who, through no fault of their own, just being in the wrong place at the wrong time, and was shot and injured and lost the use of their legs, their lower limbs, and they didn't know. Nobody told them. They were there in the hospital that this was happening nobody told them. They did not know. He said he did not know anything. Nobody to this day has said to him, and give that kind of counseling,
right,
and to give the support. And it is something I think, we really need to look at in our medical practice. How do we treat with our patients when
absolutely,
they have suffered loss, and even when they have not suffered loss, how we treat with patients who are going through trauma from,
absolutely,
and surgery, and you talk to them, and this is something that I think we need to make an effort more in patterning
definitely,
our North American counterparts and so on, and how they really treat with patients and speak to even the simple act of the medication that they're going to
yeah,
take. They're told,
mm-hmm.
what it is, what the side effects are, or what the purpose of it is, and so on. And I think we need to really step that up, and it gives patients a little bit more confidence and reassurance
Yeah.
that, well, I'm still alive, I'll be able to make it somehow, and they don't get into that state of depression. Because
Right.
yeah.
And as a psychiatrist, we do interact a lot with other specialties who, want an opinion or want us to see persons who are in need of surgery but are having some mental health challenge. And so we usually take that opportunity to, because sometimes, persons may get more focused on their area of specialty, as you say, and maybe lose the fact that there is more to discuss with the patient. And that it doesn't need to be a psychiatrist or a counselor, that just your general doctor, anybody who is interacting with you should take the time and the thoughtfulness to discuss certain things. And so we always take the opportunity to remind colleagues that, you are still their primary doctor, and it is still important for you to share with them and explain as much as you can to them and give them that comfort. With that said, of course, that is not a general thing. We do know that some doctors, some physicians will be much more in depth with their, their cases and their explanation. But it is unfortunate to say that there are some who don't take the time to do those things, and it would make a massive difference. Because not everything requires a psychiatrist to explain or to discuss with. It can simply just be the primary managing doctor.
Yes, yes. Okay, thank you so much, Dr. Robinson. Vanessa Banton again. We take your hand now at this time.
Thank you. So just to react, very unfortunate situation. But we have to understand that some of us, the nurses and the doctors, keep passing the buck because, like North America, we get very litigious, conscious. And so some of us do not want to disclose information because it's not my duty to do so.
Okay.
However, I don't totally support what goes on in North America because I have worked, hustled there, and a lot of time the clients will come home to me with a barrage of questions when they find out who I am, to either confirm or to alleviate their fears because they are so fearful in North America that they are worse than us. But I can tell you for sure that in hospital, and I'm not taking up for anybody, we pass the buck and persons get very busy. And if someone see you spending too much time with that person, then it's another feeling for the next person that you are spending more time with the other person. But just to do another little bit, promotion, there are places and there is a place that antenatal care is given now where both partners are welcome. And if we utilize the domiciliary midwife, they go to the homes, and men, excuse me, men are not always open to talk, especially publicly. But
Right.
when you go to the homes and you are in that little control space, then they will cry, they will grieve, then the guilt will pop out, and then you will know and assess the situation and refer accordingly. And
Right.
doctor, I spent a lot of my years working at St. Jago Park too. So
Mm-hmm.
I would have been in that their situation
Yes.
with Dr. Good, etc., etc.,
Yes.
etc. So and maybe because I'm the talkative one and I will observe them and chat up to them, I will see when they really change.
Right. And sometimes that's all it is. You're observing them, and it just takes somebody to say, "But how are you doing?"
Right. Or why you look so?
Yes.
Last week you look so happy. What happened to you this week? I heard you just a laugh so. Because somebody look too happy. We don't understand the kind of emotions because they are just laughing. And laughing without reasons is a form of mental issue too. So you have to pay attention to even that in persons. But
Mm-hmm.
just to say to my sister, I'm really sorry that you have had that kind of experience.
Yeah.
And persons are very inconsiderate. And then I will share go and suffer after the baby never born. So well, it's a long time ago. So, the hurt is still there. Some pain is still there. But God is in control and you still have your sanity to speak about it. Thank you very much.
Okay, thank you so much. Do we have any other questions? Am I seeing any other hands there? Oh, Karine. Karine, you may go ahead.
Good night, all. Good night, Dr. Robinson.
Good night.
I just like to know for a woman who has had a spontaneous vaginal delivery and one that has had a C-section, Is one of them more prone to exhibit postpartum depression? Can you say and why? Thank you.
Okay, sure. So woman for woman, not necessarily, because they're going to both, as I said, have their own different genetic risk, their own risk factors from before. But having a C-section as a, not necessarily considered a complication, but as a more difficult postpartum period, you would probably be more likely for that to impact you negatively than a vaginal delivery, just because the downtime for vaginal delivery, as we know, is usually much shorter. So having a wound to care for, having more pain and so on, that is going to be a physical factor that would then make it a little bit more challenging and add to whatever other risk factors you had to say, well, yes, it's perhaps a little bit more towards adding towards your potential for depression having had a C-section.
Thank you so much.
No problem.
Okay, I don't think I see any other hands up at this time, and I don't have any other questions in the chat. Okay, I see Tanya Wright coming on. You may go ahead, Tanya Wright.
Good night, colleagues. Good night, Dr. Robinson.
Good night.
Just to expound a bit as it relates to the vaginal delivery and the C-section, more than likely, I knew the C-section would have been the response to it. Can you really provide guidance to coping mechanisms for same? Because I have a friend and she's heading down that road.
Right.
And I would like to be a strong part of her support system.
Right. So it would be the same general things, but because I guess with a C-section, so the physical pain is going to play a part, the physical immobility, and the feeling of isolation. So where you can assist somebody with that. So one, she'll need to ensure that her pain management is good. So that is alleviated. You'll want to assist her with mobility. So even if she has to sit and rest, you want her to sit outside, maybe get a little bit of sunlight. Because she won't be as mobile and perhaps feeling more lonely, you probably want to spend more time with her. Again, don't just be cooped up in the same room, but having her go sit out in the living room, sit out on the patio, having people visit to the extent that she's willing to. But you just basically want to reduce as much of that feeling of physical isolation and discomfort. And then also, when it comes to the physical health now, so it's going to be difficult lifting the baby, lifting heavy things. So basically, we're talking about support, and reducing her feelings of isolation. I would look at it from perhaps those three aspects: reducing her pain, giving her as much physical support as possible, given that she can't do as much, and so not, and then giving her just that socialization so she doesn't feel so isolated, cooped up, allow her to move where it is possible, get some sunlight and so on, so she doesn't get in this one stuck position. Those would be probably the most pressing things, because and then the rest of it is going to be all the same as with just a regular delivery. But giving her a space to talk about how she feels, giving her a space to cry, and where you're seeing where she should be healing, the wound should be healing, she should be feeling better. So that should lift. So you're really just trying to get her through that difficult healing period with some of these things. But definitely to ask beyond yourself if you think that it is really going down a negative road, even when she's physically healing. If she's not feeling better, then she definitely needs to need more than just the family support alone.
And so do we do all of this that you have provided for me with the presence of the multiple, because it's a twin?
Oh,
yeah.
So that means you need more hands.
She's already...
You're going to need more hands.
Happy for the pregnancy, no doubt. Excited, but then when we went to do the ultrasound now, we found that, they were happy in there. They were bubbly and all over the place. And so she passed out. Doing ultrasound. Yeah. So it has started already. So we do all of this, but do we do all of this in the presence of the babies, or do we, give the babies downtime to sleep, and then we put, have more time with her and all of that?
Absolutely. I always advocate for mothers to get a small amount of self-care every day if it is possible. It's not usually possible, but even half an hour to let her feel like herself. Um, some mothers have that anxiousness where they don't want to be separated from the babies, and even that is heightened. You know, she really should have time to sit with her girlfriend and just ventilate without the baby right beside her. You know, those things, those are usually helpful.
All right. Thank you very much.
No problem.
Okay, it seems like, let me see, make sure I don't see any other hands, and I don't have any other questions in the chat. All right, so I see.
No, just to respond to Tanya.
Okay, yes, go ahead.
Tanya, if she needs extra antenatal support, she can come to Amadio on a Tuesday or Wednesday morning, where there is extensive chatting, counseling, reassurance.
JP, that's out by Dr. Rockhead?
Same place.
Tell me the location of that.
Young Street.
Young Street.
Amadio, Young Street. Tanya knows where. Tanya knows me too. So
yes,
Tanya on a Tuesday morning or Wednesday morning.
Yes,
Tuesday morning or Wednesday morning. Yes, ma'am.
All right.
Thank you very much.
All righty.
Okay, thank you so much, JP Banton, for your insight and for your support in this regard. As always, we appreciate it.
You're most welcome, ma'am.
Yes, ma'am.
I'm down, but not out yet, you know.
Not at all. Certainly not, because I was about to give you additional duties, you know, and say you need to now begin to advocate for that, you know, bedside thing, and maybe get a group of retirees to volunteer to doing that. You can start something, you know, you never can tell.
Yeah, we would be able to start something. Who wants to do that anyway?
Of course. Because, I know you can find them, you know, find them and start small, and you'll be surprised to see how it grows. Okay, and I'm sure you'll have Dr. Kristen's support.
Yes, you know, I always have the mental health department on my back, you know. Yes. You're always there as our support.
Yes, right. Strong supporters of maternal mental health.
Yes. Ma'am. All right. Okay. This was indeed a wonderful session. Very, very informative. And of course, very useful, because we now know, and we know who we can call on. If you know someone in your community, if you have a family member or friend, we know we have Dr. Kristen Robinson, who we can, you know, nudge a little and call and get some support. And of course, we have our own JP Vanessa Banton here too. She's retired, so she has lots of time on her hands, so we can pull her out and get her.
Really now, okay.
And get her support, and then we get her a little rest. So yes, this has been a very great session. Wonderful.
Thank you for having me.
We thank you so much for taking the time to be with us. At this time, I'd like to invite JP Paulette Coley from the Southwest Zone to move our vote of thanks. JP Coley.
Good evening, everyone. Good evening. Can you hear me?
Yes, we're hearing you, JP. Go ahead.
I want to first thank Almighty God for all of us to be here tonight. On behalf of the Honorable Custos Rotolorium, Iselin Golding, and the St. Catherine Justices of the Peace of Jamaica, and other guests on the platform tonight, I want to thank you, Dr. Kristen Robinson-Barrett, for taking the time out of your very busy schedule to be on tonight to address this forum on this very relevant and important topic. Dr. Barrett, in your presentation, you outlined to us the different signs that can lead to postpartum depression. You spoke about the postpartum blues that kicks in a few days after a baby is born. You assured us that these first few days are normal. However, you told us that if these continue, it means that intervention will be necessary. You identified some risk factors, example, assault, unstable home environment, financial problems. You spoke about specific areas like memory loss, lack of sleep, poor self-esteem, suicidal thoughts, etc. You also outlined that if these risk factors are left untreated, can develop into long-term problems like relationship problems, substance abuse, etc. You stressed that when things have gotten to this point, professional help and treatment plans are very important to mitigate against further damages. I am very sure this information came very timely, and after tonight, we will be paying more attention to these telltale signs and, of course, take the relevant action. Again, thank you so much, Doctor, for gracing our stage tonight. Thank you.
Thank you so, so much for that vote of thanks. And thank you very much for having me. And thank you for your attention. And I do hope that it was well received. And I've seen the messages in the chat. And thank you very much for the positive feedback. It was my pleasure to present tonight. And I hope you all enjoy the rest of your evening.
Okay, thank you so much again, Dr. Robinson-Barrett. Thank you so much for being here. We do appreciate it. And thanks to all of you, JPs, for sharing this evening. Thanks to the executive of the St. Catherine Justices of the Peace Association. Thanks, Mr. President. Thanks to our Honorable Custos for all the support she has been giving to the parish of St. Catherine and our fellow JPs. And of course, coming from Justice Flavor J, happy Women's Day to all the women on the platform. And of course, indeed, we have had the very relevant topic that suits the month. And so as we care for each other, we always seek to have relevant topics on the platform. So I want to bid you a good night and have a good night's rest. And as the weekend approaches, do have a safe and a great weekend. Get your batteries recharged and be ready to face the new week that is ahead. May God bless you all. I thank you so much for sharing the platform this evening. Have a good night, fellow justices and our invited guests.
Please remember the play on Saturday.
So we have the play on Saturday, so that's a good way of recharging your batteries. So remember the play, okay? And what's the name of the play again? Can anybody tell the name of the play? Let me see who's going out already. What's it?
Pigview Heights.
All right. Okay, we got it. So we see you there at the play on the weekend, all right? And it is at the Courtly Auditorium. And if you have not got your tickets yet, please be in touch with your zone representatives or the Office of the Custos, where you can get your tickets for Pigview Heights. And it should be another one where you'll have some great laughter. All right. God bless you all and have a good night.
Night, safe trip to the bathroom.
Good night, everyone.
All right.
Thank you. Good night.
Good night. Good night.
Good night. Good night, everyone. Good night.
Good night.
Good night.
Welcome to Disciples Covenant Ministry.